Hey guys, in this video we are going to go through the first part of chapter 23. It's urogenital, so we'll go and start talking about all the parts. We always start with anatomy, and then we'll go into the other sections about what caused the illnesses later on in the chapter. So, of course, we have an example of urine and how you can culture it and see what's actively in there. If they've got a UTI, culture the urine and see what grows. So we can see that culture here in the picture. Let's go through anatomy and physiology parts. Before we do, we have our case study, and it is Nadia. She's 26, newly married. She's a newlywed. She has unusual discharge and itching and discomfort. She is due for her physical, so she makes an appointment. She's not quite sure what's going on though with those symptoms. She's worried she might have some sort of STI. So she is, happily married, but she's not sure about her spouse's sexual history, and she doesn't want to ask him about it. So she's not comfortable asking her spouse about his history. So she describes her symptoms to her physician, tells him that she's worried that she's got an STI, and so they take samples, blood, urine, and discharge, and they're going to send them off and see what's going on with Nadia. All right, anatomy parts of the urinary tract. So urinary in general, we're going to have major components. So major components, we are going to have kidneys, and the kidneys are going to filter the blood. All of you who've already had anatomy and physiology 2, you already know all this stuff, but anyone who has not had AP2 yet, we have kidneys. They're going to be the excretory system that filters the blood, and then they're going to filter it out, and by the time it processes through the nephron and all of the parts along the nephron, it's going to go out of the kidney through the renal pelvis and into the ureters, and it's going to travel down the ureters with peristalsis and gravity, and it's going to end up down in the bladder down here, and that's where we're going to store it. So we've got 2 kidneys, 1, 2 ureters, 1, 2. It's going to go down to the bladder, and then the bladder's going to store it, and then when we are ready, we're in a spot where we can actually go, we're going to release that urine, and it's going to come out in the urethra. So those are major components: 2 kidneys, 2 ureters, 1 bladder, 1 urethra. We don't need to know about the adrenal glands or renal artery, not so much. Tiny stuff. Well, I guess we shouldn't need to know about the renal artery, but blood flow is going to come in. I'm not going to make y'all memorize the blood flow to the kidney because that's for anatomy and physiology, AP2. But blood flow is going to come in, and basically it's going to get filtered. So where it gets filtered, the functional unit is called the nephron. And so we're going to have this thing called the glomerulus. That's going to be a bundle of really tiny capillaries where filtration is going to happen. So basically, I always equate it to cleaning out your closet, where you pull everything out of your closet, right? And then you go through it and you sort it, and what you want, you put back in, and all the other junk gets put away. That's what's happening in the glomerulus. So you're filtering out all the stuff, and then what you want gets back into the bloodstream later on, and what you don't gets put out as filtrate, and then eventually it's going to turn into urine when it leaves. So here's our glomerulus here. It's inside the Bowman's capsule. It's going to go through all of the PCT, loop of Henle, DCT, and then collecting ducts down and out into the renal papilla and out of all of the minor and majors, renal pelvis into the ureter coming down. So here's our ureter. So this is the small thing. It is the nephron. It's the microscopic level when we get down to the teeny tiny parts of the kidney. There are lots of these, millions of these in the kidney, and all throughout we are going to filter the blood and send it out through the ureter, and it's going to go down and be stored in the bladder. So those are major parts of the reproductive, of the urinary system. Let's go to the reproductive parts. So I'm going to go left to right. We'll start with ladies. Outside are labia. There's going to be a bigger one and a smaller one. The bigger one's on the outside, smaller one's on the inside. All of it together is the vulva. It's also going to include the clitoris. other lady parts. We are going to have the birth canal or the vagina, and leading up to that, it's going to have the leading up through the birth canal. We're going to lead towards uterus, where the baby is going to be housed and develop. And so, before you get there, the neck of the uterus is called the cervix, and then now we're in the uterus, and that is, again, if somebody is pregnant, that's where a baby's going to grow and develop. If she's not, every month we have your menstrual cycle and you get rid of that inside lining on the uterus. Branching off of the uterus are going to be fallopian tubes, one on each side, and an ovary, one on each side. So you got two fallopian tubes and two ovaries. The ovaries are where the eggs are made. So we are born with all the eggs we're ever going to have. When we are born, it's roughly like 2 million or something like that. As women. And then as you develop, once you get towards puberty, you have fewer and fewer eggs. And then as you go through a menstrual cycle every month until menopause, you will lose eggs every month. So those eggs are, I say there, it's where they're made in them, but they are technically they're made before you're born. And then you go through meiosis and you will further along the stages of meiosis. We're not going to get into that in this class, where you stop and where it starts and everything. But we're just going to say that the eggs are coming from the ovary, so we don't launch into a side lecture. But those are basic parts as far as reproductive. We've got ovaries where the eggs are coming from. They are going to travel down the fallopian tube and into the uterus, and then out of the uterus, assuming that fertilization doesn't happen. That unfertilized egg is going to go out of the uterus, through the cervix, down through the vagina, and out the body. Next to all the female reproductive parts is the GI tract. So the last part of the colon is going to be the rectum, and the anus over there. As far as urinary, we said that we had two kidneys, right, and two ureters, and they're going to release the urine. Filtrate is now called urine once it hits the ureters. It's going to release the urine. It's going to go down, get stored in the bladder. Here's the bladder. So if you have a pregnant female, that uterus that is growing baby is tap dancing on top of the bladder. Here's our bladder. So there's the bladder, and then urine comes out through the urethra right here. So ladies are going to have a very short urethra. We are more prone to UTIs because of a short urethra. Let's talk about the guys. I think we've covered most everything on here. Yeah. All right. Talking about male parts. We can talk about where the sperm is produced. So unlike women, when we're born with all the eggs we're ever going to have, guys make sperm all the time, 24/7, until they're old and gray. They will still make sperm. So the sperm is made in the testes, and it will grow, but it won't mature and develop. It takes about, I want to say, like 30 days for a sperm from the spermatocyte, from the stem cell, all the way into a mature sperm that's got a tail that allows it to be motile. That is going to happen in the place where all the sperm is going to mature, the epididymis, and that's back here. So here's the testes, here's the epididymis, and that's kind of like the sperm storage compartment where everything grows and matures. And then when it's ready and it's mature and useful, then it's going to go follow this tube called the vas deferens up and around the backside of the bladder, and it's going to meet up with 3 glands, because ejaculate's not just sperm. There's going to be secretions along with the sperm, and all of that together is going to be ejaculate. So there's a seminal vesicle. That's this guy right here. There's the prostate gland. That's this other big guy who sits right below the bladder. So when we talk about males having issues with bladders, and it's possibly an older male, prostate issues are one of the things that we may need to think about, because in the prostate, that vas deferens is going to meet up. It's going to pass the seminal vesicles. They're going to release their secretions. It's going to go into the prostate, and we're going to have the little tiny ejaculatory duct that meets up with the urethra, and now everything combines. And that happens in the prostate. So if the prostate is swollen, then it's squishing in on those tubes, and it may make it to where it's hard to urinate for males. So we have passed the seminal vesicle. We have passed the prostate gland. There is another gland in here called the bulbourethral gland. It's right there, but it's not mentioned. Bulbourethral gland. That's there. And now we're in the urethra, and we have the urethra will go all the way through and out of the penis. The penis has spongy tissue in there, just like women have spongy tissue. So when I mean spongy tissue, I just mean it gets engorged with blood. So spongy tissue on female would be the clitoris. Spongy tissue on males, it's not labeled here at all, but it's corpus cavernosum and corpus spongiosum. It's all of this stuff right here is spongy tissue that gets engorged with blood. I think we've covered most of the male reproductive parts. Yeah. Okay, so we're gonna move on past those guys, and we can talk about um, basic things. We're gonna filter the blood in the kidneys, and the kidneys are going to pull out everything that we didn't want, and the blood capillaries that are wrapped all around the PCT, DCT, loop of Henle, all of that are going to reabsorb what we want, and then they're going to whatever's left over is filtrate, and that is going to go into urine, and that stuff is sterile. So urine coming from the kidneys, that's sterile. Urine going down to the bladder, that should be sterile. If somebody is doing a collection and they do not have a UTI, they might have some bacteria initially upon their sample. So that's why you tell somebody when they're going to collect a sample that you let them go to the bathroom a little bit and then you collect it midstream so you don't get the bacteria that may be just on the tail end of the urethra, because otherwise it should be sterile unless something's going on. So kidneys are sterile. Other areas are going to have their own biome. So there may be some bacteria that are living in the distal part of the urethra. The urethra is going to be flushed out by that sterile urine. But there's going to be a biome there. The vagina is definitely going to have its own biome as well. There's different things that can affect that, and we'll get through that later on in the rest of this semester. But okay, so infections and a whole bunch of different signs and vocabulary terms. Pyelonephritis and glomerulonephritis both are having to do with the kidneys. Pyelo could be lower urinary, lower UTI could cause it. Upper UTI, it's going to, if you've got pyelonephritis, close. I don't think it was quite there though. Signs and symptoms: fever, chills, nausea, vomiting, and possibly lower back pain, and frequent urination. So this is, both of these are kidneys. Glomerulonephritis is going to be just like it sounds, got glomerulus in the name. So that's inflammation of the glomeruli, the little bitty parts at the beginning of the nephron. And pyelonephritis is infection of one or both of the kidneys. So this is specific location on the kidneys. This is whole kidney. What about cystitis? We have that one in here. Yeah, that's going to be, so we're coming down from the kidneys, and you could possibly have ureteritis, infection of the ureters, coming down from the kidneys. It's not normally an infection that you'll see. It's kind of rare coming down from the kidneys, but ureteritis. Then we're going to meet up with the next stop, and that was the storage place. So that's the bladder, and we have cystitis. And then leaving the bladder, urethritis. So basically all the different parts along the way on our urinary system could possibly be infected. And if it is, it ends in itis at the end of it. Pyelo and glomerulo, kidneys. Ureteritis, ureters. Cystitis is bladder, and urethritis, urethra, leaving the body. Specific infections for males or females: epididymis, epididymitis. That's this guy. So we said where the sperm go and kind of hang out and grow and mature is the epididymis. And so sometimes a bacterial infection can cause epididymitis, and that would leave that area sore. It could be inflamed and red. Orchiditis is infection of the testes, and that can also have the same sort of symptoms: sore, redness. We can get mumps can cause this same situation to happen. Most of us have MMR, but in case the MMR didn't take for some reason, or you didn't get the second booster or whatever, Mumps might also lead to orchitis. Prostatitis, infection of the prostate, inflammation of the prostate, and that could cause, like we said, it could cause it to squeeze down on the urethra. So it may be difficulty urinating, hard to empty the bladder. Even ejaculation can be painful with prostatitis. Looking at females, vaginitis. If we are talking about vaginitis, that is any kind of inflammation going on in the vagina. So if it is inflamed, that's vaginitis. If it is inflamed for a specific reason, if we're talking bacterial, vaginosis. Vaginosis would be a bacterial infection causing that bacteria causing that infection on the vagina. If it's not bacterial and it's fungal, then it's a yeast infection. PID, pelvic inflammatory disease, is going to include the uterus, the cervix, the fallopian tubes, and the ovaries. PID is serious, especially the most serious part of that whole body part are the fallopian tubes, because if it can inflame and damage the fallopian tubes, it might cause scar tissue, and that scar tissue may possibly render that person sterile. They may not even know that what's going on and that they have this issue. But if the fallopian tubes get scarred, then the egg can't get out from the ovary. It's basically like a tubal ligation, and the egg can't get out, and it can't meet up with the sperm. And so fertility issues can come about from PID. PID can be caused by gonorrhea and chlamydia trichomonas. So both STIs can possibly cause PID. Reasons that you might see these, not bacterial related, might be hormonal changes. If we're talking about women, changes in estrogen play a role in how the vagina is doing. If estrogen levels get too low, then the pH is going to increase. We're going to get a little more alkaline, and that throws off the microbiome in the vagina. And so you might be more susceptible to vaginosis or yeast infections if estrogen levels are low. It's also going to impact other things. If estrogen levels drop, it's going to change the pH, but it might also impact the thickness of the vaginal wall, which could lead to tearing. It can also lead to dryness too. All of this, low levels of estrogen. So hormones play an important role for women. Fecal contamination can definitely happen because especially in women, those two places are located pretty close together. So you got to be careful on your hygiene, that you're not wiping the wrong way and possibly putting fecal bacteria in places where it shouldn't go. So fecal contamination is a possibility that can cause UTIs. Other things that that could cause enlarged prostate could be an issue that could cause a UTI, because if you can't, flush out your system like you need to because the prostate's enlarged, that could lead to a UTI. Kidney stones can also lead to a UTI, and urinary catheters, like we mentioned in the previous chapter, where the lady had the spinal decompression surgery in Vietnam, and the catheter was the source of her infection. That can definitely lead to a UTI. And then, of course, STIs. STIs or STDs, they're the same thing. CDC prefers STD. WHO prefers STI. Same thing. It's a sexually transmitted disease, sexually transmitted illness, gonorrhea, chlamydia, those kind of things, STIs. And those can definitely lead to reproductive issues, reproductive infections. So that's the anatomy part of chapter 23.